Good morning, everyone. Myself is Dr. Shweta Bhagat from Neurosurgeon India, and today it's a pleasure to have with us Dr. K Rajan, who is currently working in Tumors Hospital, Gurgaon, as a post of Chief Neurospine Surgeon and Additional Director of Neurosurgery Department. He is an AO International Certified Spine Surgeon with an experience of 20 years in the surgical area. He is completely dedicated to minimally invasive keyhole treatment of the spinal surgeon. Sir, I welcome you on this platform and thank you so much for joining us.
Hello everyone, I'm Dr. K Rajan. I'm Chief of Spine Neurosurgery and Additional Director of Neurosurgery at Tumors Hospital, Gurgaon.
Sir, so what are the most causes of the spinal problems and how can we prevent them?
It's a very broad topic, causes of spinal problems. If you look at it scientifically, then there could be because of tumors, it could be because of trauma, it could be because of some infection like tuberculosis, or it could be because of wear and tear. Right? These are broadly the major categories where the spine problems happen. But if you're asking me the most common is degenerative. Degenerative means wear and tear. Now, because of increasing age, increasing weight of generally in the society, and also because of sedentary lifestyle, we have noticed that the spinal joints and discs, they tend to become damaged. So it's a wear and tear, like you have a knee problem where you require knee replacement. The same wear and tear can happen in the spine also, and that can cause back pain, pain going into the legs, all those things. Similarly, it can cause neck pain, pain going into the arm. So this degenerative cause is most commonly happening because of sedentary lifestyle or bad posture. So if you're asking about prevention, then I would say if you are keeping a good bone health, if you're taking adequate precautions in terms of the right posture and also, for example, right way of lifting weights and keeping a good nutrition. So all those things will help you in minimizing the chances of spinal problems.
So, sir, how do you evaluate a patient's spinal issue that can be treated with the physical therapy or the patient requires surgery?
Very good question. In patients who present to us relatively early, who have predominantly neck pain or pain which is in the back or going up to the hip, and which is not accompanied by any weakness, in those cases, physiotherapy works wonderfully well as a primary mode of treatment. However, in patients where the physiotherapy has either already been tried or there is neck pain which is going into the hands, which is not resolving on normal medications, or back pain going into the legs, which is not resolving on normal medications, physiotherapy, precautions, all those things. And there is also a corresponding compression on the nerve in the neck or in the back. So this is important. So you have to have some abnormality in the MRI, which is indicative for the need for surgery. And then we correlate with the patient's complaints, duration, severity, and the response to the previous medication. So in general, to begin with, most patients will respond very well to physiotherapy. However, in advanced cases or in patients where there is severe compression on the MRI, then we have to start thinking towards the surgical treatment. There is also another treatment in between medicines and physiotherapy and surgery, which is injections. Spinal injections can also help many patients, but that's a very big topic in itself.
Moving on to the next, can you please explain us how maintaining the good posture and the regular exercises gives a positive impact on the spinal health for the long term?
So it's a very relevant aspect which people often ignore is our posture. In the sense that because the life has become very sedentary and there are a lot of people who are doing system work, so the tendency is to be very casual about the way they keep their screen, about the way they access the phone and they consume the media on the phone, and also in the way they are normally sitting for a long time. So anybody who has back pain or neck pain would have realized that it is often because of bad posture. So in those cases, we normally recommend that if you are working on a system, then ideally speaking, your screen should be at the height of your eyes, and you should have adequate support of your elbows, and the the keyboard also should be close to your body, so that you not have to bend forward to either look at the screen or to work on the keyboard. Also, rather than having just a table, if you have a slider which you can pull the keyboard back, that is better. I'm talking about people who are working on systems. Also, every now and then, every half an hour, 45 minutes, get up, stretch yourself, your neck as well as your back, and sit down again. That can also help. For lower back pain, the best prevention is to avoid bending forward at the back, lifting weights, squatting, kneeling down, lifting children, all those things. If they have to be done, there's a particular way of doing it. You bend your knee, lift up the weight close to your body, and also if there is a pain which is going into your leg, in those cases you have to avoid it. So these are a few recommendations for postural management so that we don't have increase in the back or the neck pain.
So moving on to the next question, what makes the minimally invasive surgery different from the traditional surgery, and what are all the benefits of the minimally invasive surgery?
Look, in traditional surgery, we often are not able to see the bone inside. So in that case, for any surgical area to be exposed, you have to give a long cut, and you have to remove a lot of muscles, which are the stabilizing muscles of the spine, and then only we can understand which bone is where with the help of the X-ray. And so that limits us in terms of the, you can say, the post-operative recovery, because whenever the muscles are cut, the post-operative pain will be more, blood loss will be more, chance of infection will be more. So all those things become a major deterrent for patient's recovery. Whereas in a minimally invasive spine surgery, we are able to offer the same benefits but through a smaller cut. In that case, the muscle dissection is less, also the pain that comes out of it, and chances of infection, chances of blood loss, and recovery, they overall become, blood loss comes down, infection comes down, but recovery becomes faster.
So what all are the recent advancements in the spinal surgery which had the biggest impact on the spinal recovery and their success rate?
One is the understanding that the nerves are of paramount importance. The earlier the focus of spine surgery used to be on the bone, that you need to put screws or we need to remove the bone. That's not true. The focus has to be on the nerves. So as long as the nerves are decompressed well and safely, chances of spine surgery going wrong are quite less. Then the other aspect is that we have seen the imaging has helped us a lot. One is obviously development of MRI, easily availability of MRI. And then intraoperatively also now we have got spine navigation, which helps us significantly, in the sense that spine navigation will give us a guideline regarding where to go. It gives us a more, you can say, it's like a robotic navigation, gives us accurately the direction in which we need to go so that the complications of misdirection don't happen. So that is one of the major advances. For patients who are having already some weakness in the legs, intraoperative neuromonitoring has come as a major boon. So like you have a ECG of a patient where it is working all the time and giving us an idea about how the heart is functioning. So it is like an ECG for the nerves. So during surgery, you get an idea how the nerves are functioning. So if there's any dip in the signals, you can come to know and you can change your course of surgery or speed of surgery or plan of surgery. Otherwise, often what used to happen was that patient was anesthetized and after surgery, patient would wake up and would have some weakness. So that incidence of complication has come down significantly because of the availability of navigation, minimally invasive spine surgery, neuromonitoring, and of course, better understanding of the nerve function.
Thank you so much, doctor, for taking your time and sharing your valuable knowledge. Thank you so much for joining us. Thank you so much, everyone, and please subscribe and like the channel for the future updates. Thank you.